Hi, I'm Lynn Antonopoulos, reporting for Daily Bulletin. I'm talking with Dr. Kathy Schilling, a breast radiologist and medical director at Christine Lynn Women's Health and Wellness Institute in Boca Raton, Florida. She is sharing key learnings from her RSNA 2024 session, Real-World Effect of Artificial Intelligence on Histopathology and Stage in Breast Cancer Screening with Digital Breast Tomosynthesis. Thank you for joining me today.
Thank you.
Dr. Schilling, how did AI support during digital breast tomosynthesis screening aid radiologists in your study?
I think the biggest thing that AI gave us in reading DBT exams is confidence. When we went from 2D mammography to 3D mammography, we went from 4 images per case to hundreds of images per case. So we're seeing tens of thousands of images a day. And when you realize that 90% of the time there's no findings, it becomes very difficult to keep your focus and concentrate on those things that may be important to find early breast cancers. And so you have a co-pilot with you, looking at the images with you, and it just refocuses your attention to something that may be of importance. And so as a result, we're finding more cancers, we have fewer false positives and fewer false negatives. But also we can gain efficiencies using AI in our practice. Patients who have low suspicion mammograms, you can go faster through those cases and spend your time more effectively on the cases that have something of suspicion. So we gain confidence, but we also gain efficiency.
Great. So how might the earlier detection impact standards of treatment for patients?
Well, I think we're finding very, very small cancers, probably years before we would find them without the use of artificial intelligence. And I think back on my career and before screening, every patient had mastectomies and axillary dissections, but when screening came, we changed. We went to lumpectomies, we went to sentinel node dissections, and now I think we're entering the next stage where screening with AI, we're going to find even smaller cancers and we're going to be able to adjust the treatment that we're recommending for our patients. So I think it's a new era coming on.
And what advice do you have for other radiologists interested in implementing AI in their breast imaging practices?
I think the biggest thing is to remember that it's not CAD. We all have bad impressions about CAD in our practices in the past where it really never helped us. This is different. This is something totally different. AI continues to learn. It gets better and better and finds things that we can't even perceive. Our brain, we can't see them and our brain can't even perceive them. I think you have to give it time. It's not going to happen overnight where you see changes in your practice. So maybe 3 months, 6 months to really find out where it functions best and can help you in identifying these cancers. So it takes time, it takes patience, but you need to put the time in. Your recall rate may increase initially, but that's how you learn where the AI can really help you. So it's about patience, give it a chance, but it really works.
Wonderful. Well, thank you for your time today. For more information about the study, look for this RSNA 2024 session on demand at rsna.org/meeting-central. And as always, you can find more radiology news at rsna.org/bulletin.